it's me, Tracy, here at Lakefront Family Dentistry, office of Dr. Hauser and Dr. Cantor. And I'm here with Bryn today. She's one of our wonderful hygienists here, and she's going to be talking about x-rays. We have a few questions we would like to ask her and get her expertise. So here we go. Miss Bryn, are x-rays here in our office dangerous to our oral health and overall health?
I get this question a lot in the chair from patients who are very concerned about radiation exposure. It's a very common misconception that people have. Actually, the amount of radiation that is emitted in dental x-rays is super, super low. You're exposed to more natural radiation just on your cell phone or smoking or being by your car than you are at all in dental radiographs. Actually, if you like bananas and you eat 2 bananas, that's the same radiation exposure as you would get from 1 x-ray, which I'm sure you do in your normal life. So I know it is concerning because people think radiation and that's scary, and it is scary, but the doses that you actually are exposed to are so low that they're negligible. So the benefits far, far outweigh any risk that there is with x-rays.
Our high-tech technology here is awesome.
Yes.
Next question. What about the handheld x-ray equipment you use, referring to like Nomad units?
We do have Nomad units that we use in the office. Dr. Hauser really likes these units because we are able to move them from operatory to operatory, so all the clinicians in the office can use them. They move around like this kind of, so we can actually get better angles, whatever angles we want to get on x-rays. So it allows us to get the shot the first time instead of having to take multiple x-rays, which exposes you to less radiation, which obviously everybody wants.
Nice.
Also, the clinician is in the room with you when you have these x-rays done. So there's actually built-in shields in the machine that will deflect scatter radiation so that any radiation that could be there is deflected off away from us. So I think that makes people more comfortable too, that they know that the radiation that is there is so low that the clinician is actually standing right in front of you while you're in the room getting the x-ray taken.
All right.
So, and with kids, it's also very helpful too, because a lot of times we want kids want us to be in the room with them, or they move around really fast. So having that handheld unit where we can be right there and take it really fast, it's helpful for children as well.
Awesome. Well, is it safe to use both types of equipment on children too?
Yes, both types of equipment are very safe. We have the Nomad units that we have, and we actually also have a 3D imaging machine in the office that Dr. Hauser likes to use, which both machines are going to help us catch the best image that we can at that moment, and that is going to lower the chance of radiation exposure because we're, again, having to only take limited numbers of pictures in order to catch the image that we want. With children, it's actually very important for children to get x-rays taken. They almost need them more frequently than adults do because they do have very high incidences of decay just in their diet and their baby teeth and things like that. So the Nomads and the 3D imaging machine, they help us capture those images. So they are very safe for adults and children.
Very good. See, very safe. What type of things can you see with the Orthofos imaging equipment in a patient?
So our Orthofos is our 3D imaging machine. Dr. Hauser has this in our office because it allows him to capture images that we can't see on a normal 2-dimensional x-ray. So the x-rays that you see when we take them, where it's just pictures of your teeth, they're 2-dimensional. And our face obviously is not 2-dimensional. So that really limits us sometimes on things that we can see in a picture. If you ever come in and you have a toothache or something like that that's bothering you, and we take a regular x-ray and we don't see anything, which happens a lot of the time, Dr. Hauser is able to do that 3D scan on you, and he can actually take the image and manipulate it and look at it from all different angles and blow things up and shrink them down, and that allows him to catch things that he wouldn't see on a normal x-ray. So the 3D scanner is really amazing at helping us take the best care of you that we can, because we're able to really see what's going on in there as opposed to just having a 2-dimensional picture that isn't going to show us the whole story.
And it's really cool to see the 3D, to see how you can see all around everything, and that's awesome that Dr. Hauser and Dr. Cantor provide that for us. So another question we have, and the last one of the day, is it really necessary to get an x-ray before I get my teeth cleaned for the first time at Lakefront Family Dentistry?
Yes. I get this question a lot. People come in and they just want a cleaning. Everybody's cleaning is not the same. Most people don't have the same cleaning. Everyone's is a little different. Just cleaning your teeth without an x-ray is kind of like we're working blind. The x-rays are actually our map. It shows us bone levels, which is very important and is a very strong indicator of periodontal health, because the bone levels, if they're low, show us that you do have active disease or have had in the past that we need to address. We are able to see radiographic calculus on x-rays, so if there's large deposits somewhere, we can see where they're at so that we can kind of target areas. Sometimes there are things that are wrong with your bone that we need to specifically address, or the doctor needs to see. If you have anything else that's going on, decay that needs to be taken care of before a cleaning. If you have any fractures of root or anything like that that the doctor needs to take care of before you have your cleaning done, we can do that. So I would say if you do ever go somewhere and they're going to do a cleaning without taking x-rays, they're for sure not taking good care of you. That's a very important tool in our office, and we need them for everybody. Current x-rays also, so we see exactly up to the date what is going on.
Awesome, which is very true. And I lied, we do have an extra question here. And do x-rays hurt when you take them?
They do not. When I started in this industry, actually, I used film. If we can remember that far. But I used to have patients complain a lot that the film was, cutting into their gums and they hated it and things like that. And I have had more than one patient actually comment because of the new digital x-rays that we use sensors that are covered, so they're smaller than the regular film ones. They're softer because they're more rounded, where film edges are more sharp. So I've actually had many people say that they way prefer the way x-rays are now with the digital x-rays, because it is way more comfortable for the patient in their mouth. And when the x-ray is actually being taken, you don't even know. It's just like taking a picture with a camera, and then there's your x-rays up on the screen. So no, they do not hurt.
Very good. So if you are interested in coming into our office here at Lakefront Family Dentistry, we would love to take care of you. You can certainly give us a call here in our office during business hours at 951-244-9495, or you can certainly go onto our website, lakefrontfamilydentistry.com, and fill out a form to be called, and we will call you and get you scheduled at your convenience. Thank you so much for watching today.